when I started in this business, which was quite a long time ago, the goal of some of the early pioneers was to cure cancer. And we had tools. They weren't very good back then, but they were chemotherapy. And if you gave a whole bunch of drugs, they often shrank the cancer, but they never cured the cancer. And in fact, none of them actually got rid of all the cancer. If you get rid of all the cancer and you can't find it anymore, that's called a complete response. And so these pioneers like Fry and Freireich and DeVita, the idea was to combine drugs to see if you could get rid of the disease, a complete remission, and then to see if the complete remission would last, okay? And they didn't have a lot of scientific rationale. In fact, the rationale was combine drugs that have different side effects so you can give full dosage of each one, okay? So now, here we are a long time later, and we have all these tyrosine kinases that are specific for specific types of cancer, and they have very high response rates, 60–70%, which is higher than the chemos that ended up curing people before, higher than that, but they don't cure anybody. So why don't we have combinations? It doesn't matter whether it's Hodgkin's disease or TB or HIV or hepatitis C. Basically, you need combinations to cure the disease, because if you don't get rid of all the cells, soon you'll get resistance. So you got to get rid of all the cells. So yeah, it's great that we have all these TKIs, and it's great that the response rate is high, and it's great that they last for months to years, okay? But it's bad that all the patients still know they're going to die, okay? And how many combinations have been studied? Very, very few, okay? Now, it is true we could just take non-rational combinations, and it might be interesting. And there's sort of one of those that's been done, and it was the combination of erlotinib and bevacizumab. And since those drugs have each been around for a decade or more, it's interesting that there's only one small Japanese trial with that combination. Scientifically, it might not be the most exciting combination, but the Japanese trial, it seemed better. But there's a lot of scientific rationale for combinations that might work, and it may be that some combinations are better for some people than others. But if you wait until resistance, all the studies now wait till resistance and then they treat resistance, well, that's a losing proposition, because the time clones grow out that are resistant, there are other clones that are resistant that just aren't the dominant resistant to that time, and the resistance is going to come faster and faster. We need combinations. What are we doing?